Oh, hang on. We just went live.
Okay, fine. It's fine.
Hey, everybody. Guess what? We are live with Williamson Medical Center, Dr. Bullock. Thanks for coming on here. I first just say thank you because I know you have been inundated and it's been a crazy time. So thank you for all that you're doing.
Sure. Absolutely. It's been daunting, but it's also been really rewarding to be able to serve the community like this. That's why we trained in medicine. That's why we're here. So it's been amazing. And I tell you, the community has been unbelievable. We have gotten cards, letters, meals, flowers, balloons, cookies, everything you can imagine from the community, gloves, gowns that they have made, PPE, personal protective equipment that people had in their offices or at home, for construction workers, even all kinds of people have donated. It's been truly impressive what the community has done to support us, and it has kept us going.
Well, that's great to hear. We have a few questions. We know your time is limited, but we want to see if you can help us clear up a few things. So the first, we want to know about face masks. When should we wear those? How should we wear them? What's appropriate? Should we make our own? Like, what's the best practice for face mask?
Okay, I'll take a stab at that, and then you can clarifying questions if you need to.
Yeah.
First of all, whenever you're wearing a face mask in the community, it's not really considered personal protective equipment. We call those courtesy masks here whenever we're talking about cloth face masks or handmade masks that people have made or had donated, as we have, because they're really for the benefit of the other person, not the wearer, but the other person. Keeps you from coughing and spreading germs, including the coronavirus, to others. So that's why we should wear those. If we're all wearing them, we are keeping one another safe. It's really a community effort with that. It's different from what we're sometimes using in the hospital. If we're in a room with a patient known to have coronavirus, then we are wearing protective equipment, and those are special masks that are manufactured that we wear that provide protection. Does that make sense?
Yes. So let me just check and make sure I heard this correctly. If we wear a mask, we're not necessarily protecting ourselves.
Right. You're wearing the mask to protect everyone else around you, because the mask is not going to be a true barrier for microscopic particles that might be able to penetrate the mask. But what it does catch is it catches larger particles. So if you were to cough or sneeze, then it's going to catch those particles and keep those from going and being aerosolized into very small bits that could be absorbed or taken in, inhaled by someone else and taken in. So that's why we want to wear the mask. We want to encourage those. And Williamson is also encouraging everyone in the hospital to wear those masks, the courtesy mask, at all times. And we only use the protective equipment during special circumstances that are very high risk.
Gotcha. The other question people are asking are about gloves. Should you wear gloves when you go to the grocery store, when you have to go out, or to get gas, to put gas in your car? Are those really helping us, or what should we be doing?
So the simple answer is it's probably best not to wear those, because everyone doesn't know exactly how to put them on and take them off properly. So there's a chance of contaminating yourself. Plus, they provide, I think, a false sense of security in that if they have very small nicks or breaks in them, then you could still be contaminating your hands. Even in the hospital, what we do is when we're wearing the gloves, we are doing hand hygiene. So washing our hands with soap and water for 20 seconds, or using an alcohol-based hand sanitizer and thoroughly covering all aspects of the hand, again for 20 seconds, then putting on the gloves. Then we will be in a patient room or interact with someone. Then when we take the gloves off, we're taking them off properly, disposing of them properly, and repeating hand hygiene. So it's a process that most people are probably not doing. The coronavirus is actually a pretty wimpy virus when it comes to being able to kill it on a surface or on your hands. So if you're using soap and water, or you're using an alcohol-based hand sanitizer, you're going to kill it. You're fine. You don't need the gloves.
Okay. So we should keep our hand sanitizer with us if we've been in a store or pumping gas or wherever we have to be. Use that.
Right, absolutely. And especially if you know you're going to touch your face, your eyes itching, whatever, then always use the hand sanitizer. After you've touched your face, I would again use the hand sanitizer just to make sure you're not spreading things back and forth, even on your own body.
That's good to know. Um, the other question that we had real quick we want to talk about is visitor policy. I know at first you guys announced no visitors at all to the hospital.
Mhm.
Can you update us on that, the latest policy?
So the policy is the same since March 9th, which is technically no visitors. Okay, that's the easy answer. But we are actually allowing a lot of exceptions. So one exception is if a woman comes in for childbirth, she's able to have one person for support here. Also, if we have someone who is dying, then we will allow family to come in and visit in that situation, even if they are a COVID patient on our COVID-19 units. We're allowing that. We also are allowing other special circumstances. If someone is mentally incapacitated for some reason, if they need an interpreter, a driver, various other reasons, we might allow someone in. So it's taken on a case-by-case basis. We understand it's really important to be able to have that contact with family. One thing of the things Williamson has done is we've bought half dozen or so iPads, and we're using those to give to patients to be able to communicate with families if they don't have electronic access themselves. A lot of people are bringing their own, but if they don't, then we're supplying that. And the nurses know how to help. Sometimes the elderly patients don't know how to do that. How to get people set up, help them use it, and that's been a great means of communication. And we're also trying to make extra effort to call, even when normally we would just talk to the family in the room. We're trying to call if the patient is asking us to, or if the patient's not able to communicate well. The nurses, I think, are spending extra time with patients as well, just trying to be a supportive, influence in their lives, because it's hard to be in the hospital under the very best of circumstances.
Right, right, right. Uh, yeah. Well, that's good to know. So, do they have to request a visitor, or do you all guys automatically implement that for patients?
So it's usually by request. And sometimes it's obvious that somebody is going to need support, and so we may reach out, and ask for someone to come in, a family, to provide some support. And we can provide the support if the family's not able to, or if they have health conditions of their own. Sometimes it's not safe for a family member to be in the hospital.
Right,
Thing.
right, right. Well, this is definitely a different time for all of us, and we appreciate everything you guys are doing at Williamson Medical. Is there anything else that we should know that you want to tell everybody that during this interesting time?
I guess one thing I'd say is there's a lot of rumors that go around. We have heard so many false things here. I think just the anxiety is increasing that. So call us and check if you're not sure. If you have a question, ask us. We want to be here for that. Certainly, if you are sick and would normally come to the emergency room, come to the emergency room. We're taking extreme precautions to try to keep people isolated, to keep people safe. We're going to do everything in our power to make sure that you get proper care during this time. But we wouldn't want people to stay at home with chest pain, for example, because they're afraid of what they're going to find here. You still need to take care of yourselves. And part of that may be coming here. If not, definitely stay home. But if you need us, we're here.
That's good to know. All right. Well, thank you so much for joining us and giving us that information. So now I know I don't have to worry about my gloves. I appreciate that.
My pleasure. So take care.
All right. Thank you.
All right. You're welcome. Bye-bye.